Hi, I'm Sam Cassidy and I'm a science writer for the National Institute for Health and Care Research. Thank you for inviting me to talk at your webinar about what my team in NIHR Evidence does. So a presentation from the NIHR wouldn't be complete without a bit of an overview of what the NIHR does, but I don't want to focus on that as the main part of this presentation, since my team focuses on dissemination rather than the research itself. So the NIHR's mission is to improve the health and wealth of the nation through research. We work in partnership with the NHS, universities, local government, other research funders, patients and members of the public. NIHR invests over £1 billion every year in research, and the funding goes towards career development, awards, research projects, and the people, facilities and technology that enable research to thrive. It's mainly centred in England, but we do work very closely with the devolved nations as well, and obviously the research is applicable throughout the UK. So my team in NIHR Evidence doesn't work on the research itself. We focus on what happens afterwards, so once the study has been published. A key challenge that we face is not just to release the findings, but to support dissemination. So we want there to be a move from passive to active communication. Commonly, once a piece of research has been finished and published in a peer-reviewed journal, that's sort of quite a passive activity. It may not feel it because it's obviously been a lot of work, but it goes to a single audience, a single target community. It's a lot of work for the researcher, but what we're trying to help with is an active dissemination approach, where we can think about other audiences who will be interested in the research as well as those targeted communities. So something to mention here is that all research that has majority NIHR funding has to be published in an open access journal, and that's really so that everyone can access it. But they don't all have plain English summaries, and this can be a problem for people who either don't work in that specialty or members of the public who have an interest. So what we're trying to do is move to active dissemination. So we try and summarise research papers, and we remove jargon so that anyone can understand it. But we also share them with targeted audiences. So we use social media. We do a lot of organisation outreach, which we'll cover again later, but we work in collaboration with knowledge mobilisation experts to find out the best ways of reaching key stakeholders, so particular practitioner subgroups, patient groups and underserved communities. They also advise how we can format information to best be received by these different groups. Their information has really helped us to structure the alerts that we do, the summaries that we do. So NIHR has a lot of avenues for sharing research and findings. We ensure that information about the research we fund is available to patients, carers, service users and the public, so they can use the information to guide their care. So we publish information about people and the projects that we fund on the NIHR Funding and Awards website. We also have the journals library, which for anyone who has looked at one of these papers, they are extensive and really comprehensive. They cover a lot of information. NIHR Evidence is what my team works on. We produce summaries in various different formats of research papers. NIHR also produces or publishes in NIHR Open Data and NIHR Open Research. NIHR Evidence is where my team works. So NIHR Evidence produces several pieces of content, one of which are jargon-free summaries, which we call alerts. We produce 80 of these every year, and the idea is that anyone should be able to read them and understand them. But out of the thousands of NIHR-funded studies that are published each month, we need to choose a very small proportion to cover as an alert. We don't do this by ourselves. We have an editorial board made up of GP commissioners, members of the public, research fellows, knowledge mobilisation experts, among others, and between them they discuss each paper and make a decision on whether or not we should cover them. For any papers that they're not sure about, they say that we should send out to review. So we have a database of professional reviewers, people who have signed up on our website, NIHR Evidence, who have particular expertise across the board. So we have experts in pretty much every area of health and social care. And if there are papers that we're not sure if we should cover or not, or that we can do justice in the format that we use, we will ask a professional reviewer from our database whether or not they think it is worth us covering, and if we can make a difference, and if the findings will be helpful to disseminate to the groups we can reach. Based on that information, our editorial board would then make a decision on whether or not we should definitely cover the paper. Once we've decided we were going to take a paper forwards, we contact the researchers to find out what has happened since the study, and if they have produced any materials that might be helpful for dissemination, such as a visual abstract. We then write and edit the alert, which goes through quite an extensive internal checking process. We gather comments from the professionals that are on our reviewer database I just mentioned, but we also on this database have members of the public who either have an interest or who are affected by various conditions. So they could have the conditions themselves, they could be carers of people with the conditions, and this is really, really valuable. And we get comments from these people to really put the research into context. So what does it mean for them in their daily lives? What does it mean for them in their clinical practice? And it can really contextualise and ground the alert. Once we've written it and got the comments, we would pass the summary to the researcher who wrote the original study to check it for factual accuracy before we publish. We also gather organisation comments, which can be charities or patient groups, to get their thoughts on the research and what it could mean to the people that are affected by the condition. We also ask them to help us disseminate the research as well to the people that are going to really use it. We also produced collections, which are summaries of several NIHR-funded research studies. Often we would have covered these as alerts, so the shorter summaries already, but not always. They are made up of several research studies on a similar topic that brought together can tell a story. They follow a very similar process to the alerts in that we gather the information, we write and edit it, it goes through an extensive checking process, and we gather comments and we check it before we publish. These tend to be longer reads, and we do about 12 of these a year. We produce a range of formats. Most of what we do are infographics. So most of the alerts we write are text-based, but we also produce infographics, and for some alerts we have embedded a small infographic within the alert itself. These really give a snapshot of what the research is saying and the key message, and it can be a really quick takeaway. We've also produced podcasts and done quizzes, and we are about to run our first webinar on Wednesday, so please do sign up for that. It's on improving stroke services, and it covers a breadth of topics from early discharge to machine learning and how to manage thrombolysis, to speech and language therapy in aphasia after stroke. So we are trying to go to where the audience are, because not everyone has heard of NIHR, let alone NIHR Evidence. So one of the main ways we're trying to do this is by going to Wikipedia, because fundamentally what we want to do is extend the reach of the research that's happened. So it's not about driving traffic to our website as such, it's more about just getting the information out there, getting the message out there. So we have a Wikipedian in residence who has expertly taught us how to edit Wikipedia articles, so that if we cover an alert which has a Wikipedia article which is relevant to it, we can edit the Wikipedia entry to include the information from the summary that we've written. as well. And in that way, we're reaching a much larger audience. We've also been lucky enough to have some media coverage for a few of the collections that we've done recently. We do a lot of stakeholder outreach, so we contact organisations and charities to help us get to the people that really are going to use the research and be of interest to the research. We do a lot of social media, particularly Twitter, but we're also very aware that most of our audience comes from organic search, so SEO is really important for us. And so we try and really choose the keywords carefully and make sure that they are embedded in the titles and throughout the text, so that people searching for something will be able to find the information they want. We've also got some cross-publishing agreements. So we've got one with BMJ and one with the Nursing Times, where they will look at the NIHR Evidence website, and they will find articles that are of interest to them and their audience, and they put those particular summaries into their own style, and then they check it with us to make sure that nothing's been changed, or if they've got questions about anything they want to add. So we are struggling with awareness raising of NIHR and NIHR evidence. To try and get around this, we have done a few things. So we've talked to librarians at universities with medical schools in order to try and get information about NIHR to these really early stage medical students, to just try and raise awareness of who we are and what we do. And we've also talked to NHS trusts, and on the basis of those conversations, we've realised that NIHR evidence is listed in the resources for the EBSCO hub, but content doesn't actually pull into the hub because metadata doesn't pull into the system in the way that we have it. But we've also managed to get NIHR evidence content added to Knowledge Share, which is great because it means that librarians can easily access the information we have without searching separately. And we've produced a blog for CILIP in Scotland. So what else might we do? We are always looking for ways to improve. We're always looking for ways we can reach different audiences, ways we can help different audiences and different groups. So we firmly believe that our summaries can be useful for busy healthcare professionals who just might not have the time to read the full research paper. And what we really want to find out is, could NIHR evidence help you in your role? And if so, how? Is there anything we can do to make our products more useful? Is there any feedback that we can incorporate? We're a very flexible team. We're really keen to understand how we can work best with other people. There are a number of ways that you can work with us. So you can let us know about any research outputs or topics that you think can benefit from a summary by emailing evidence@nihr.ac.uk. You can also sign up for the NIHR Evidence newsletter, which is released monthly and covers a brief overview of some of our most engaging alerts. You could share the evidence summaries with people in your networks that you think will be really really interested in them, who you think it might be really useful for. The other thing is you could become a reviewer yourself. So everyone has experience that we would find helpful, whether it's as an interested member of the public or someone that has real expertise in a particular area. We can never have too many reviewers because we cover such a breadth of areas. So please do sign up to become a reviewer. And feel free to connect with us. You can get in touch with any thoughts at evidence@nihr.ac.uk. Sign up to the evidence newsletter. Visit the website, see what you think. See if there's any thoughts you've got to how we could improve things. We can't promise we'll take in every suggestion, but we will certainly consider what we're told. And follow us on Twitter and share anything that you think is particularly relevant to your networks. And thank you for listening. Any questions, please email evidence@nihr.ac.uk. Thank you very much.